All right, sorry for that, I'm admitting. So let's just, so for any stations, so make this your approach. So this is what I do all the time for everyone who study with me or do course or whatever mock. Just this is my tip. So do it in your study. Whenever you study any case, because the GMC very aware of the script, very aware, and even like 90% of script, to be honest, they're not very, I don't say wrong, but they're not very perfect one. Like many people follow the script and they didn't pass even. So just put this in your mind. So how do you approach any station while preparing? So just gain the right medical knowledge for sorry, whenever I admit someone, just because sorry for that. Okay, so whenever you want to practice any stations, first gain the medical knowledge that you need to know for this station. Like you know the topic, so what information that I need to learn, and you can write a note of them, or keep them if they are in your script, highlight them. Whatever, just be aware of what kind of information that I need to know for the stations. This is the first things. So, and after you learn the informations, then think about how to make the station in your own way. And if like someone told me, like, if I don't have enough English, how I shouldn't rely on the script. So you can use the script language to teach you a little bit, but if you think your language is not enough to answer the patient concern, if you have the right medical knowledge, but your language is not enough to make you ask questions to the patients or reply to them, this is major problem, and you have to spend 1 month, 2 months, just focus your medical language. So just learn them by heart. Read like the same thing we did in OIT. Learn again sentences, how to write, how to ask. It still is going to be your own, but the idea is I would never rely on script language. And for 2 reasons. The first one, examiners, they are very aware of, and they will not give you any marks for this very, very typical language. And because they need to assess your English levels, they need to assess your communication levels. If you came with, even they wrote in their website, like if you used stock phrases, and what they mean by stock phrases is script language, because now for them it is stock phrases, they know it by heart, they know the sentences. So if you use this, they're not going to give you mark for that. They're not going to penalize you for that, but they're not going to gain you any mark for data gathering or for IBS. So that's why you have to make your own language, learn the right language. Like even scripts, sometimes it could be very helpful in how to ask the sentence, but it still is going to be 100% your own. And the most important thing to go to the exam with the right medical knowledge, right communication skills, and right approach, and that's it. So I don't waste your time reading the script in details again and again. All right, so for this station is basically the medical knowledge we need to know. So it's gender as the station topic, just for those don't know, is about the sex selections. So in the stations, the woman came and she asking you, I want a baby boy, can you help me with that? So this is our stations. And this is the information we need to know. Sorry, just admitting. Okay, so the information we need to know is first, there is no any natural way of having a boy or a girl. For example, just there is some myths and some misconceptions around that. For example, particular kind of foods and use of various vaginal douches and timing of intercourse and the method of intercourse could influence the gender. Which is totally, there is no evidence for that. So yes, we will tell the mother there is no evidence at all for this methods could change the, or could alter the sex gender. And also the reliable techniques. So what in medicine, what is true? So there is some method called sperm sorting, which is like what they do in this technique. They do they take the sperms and put them in certain lab environments. They just add certain chemicals and like just classify the sperm into like this is sperm, it has the X chromosome on it, and this is sperm, it has the Y chromosome, and just they take the sperm that has Y chromosomes and give it to the woman if she wants a boy, and the opposite is true. And this is a non-invasive procedure, but it's still not 100% effective. We're going to talk short about it again. And also in the UK is not regulated. So you will tell the mother is not regulated in the UK. This is the other method, which is pre-implantation genetic disorder, which is licensed in the UK and available in the NHS. But it is only if there is a risk of genetic disease. So serious genetic disease, so it's allowed because even the funding is not enough. Sorry, let me admit, I'm getting messages to admit them, sorry. Okay, so this is pre-implantation genetic diagnosis. I'm really sorry for the disruptions, but okay. So this is just part of in vitro fertilization. So they take the eggs from the female and the sperm from the male and just make the boy. So which is just only regulated, as I said, in case if there is serious genetic conditions, for example, that would affect the specific sex. For example, if she wants the boy, like in our case. So in this case, if in the family there is any genetic disorder that common in boys, for example, X-linked dominant disorder, which is connected to the boy. So in this case, we will do this, like it can be offered in the NHS. Okay, and okay, so also there is other way is not to have a girl for this woman. She had, in the case, she has 3 girls. So if she will ask you, can I abort my child if it is girl again? So selective abortion is also illegal in the UK. So this information you need to know. So unless, again, there is serious genetic problem or disease that could handicap the child or can seriously affect the mother condition, the pregnancy. Otherwise, abortion, it's illegal. And also, like the parent can choose to terminate the pregnancy by other illegal ways, but it is also illegal. Just a quick comparison between this pre-implantation genetic technique and the sperm sorting. So just this few information we may consider. This few information we may consider just to tell the woman, to just convince her also to go through these procedures, even if she opt to go to private clinic, because there is a private clinic available for these things. Even if she has chosen to go to private clinic, just tell her the pregnancy rate, for example, is around 20% in both of the procedures. And also, even if she get pregnant, there is around 10% chance the baby will not be a boy. And safety, there is no sufficient information regarding safety. And cost is for £4,000 per just one attempt. Like if it's failed and it is highly, like we said, it's just only 10-20% chance to be successful. So if it failed, so she need to pay the money again. So, and yeah, it's too much money. So this is the things we need to, medical information we need to remember for our stations. So this is just like if I'm doing these stations, this is what I need to know. I will remember this information very well. This is for gender selection stations. But the next questions, how I do this data gathering and IBS, because for example, you like some people, they take seven minutes in data gathering. They ask every single question in the world, and they get only 2 or 1 in data gathering. So the question why? Yeah, so this is because you or they asking irrelevant questions. So always when you prepare for your Plab 2 exams, think about asking the top relevant questions. Don't ask silly questions. Use your brain. You all doctors, you all very, very smart. Otherwise you wouldn't have been a doctors. So if just use your common sense, your brain, is this question is relevant or not? Like I could see like in many scripts, there is heartbreaking, like just caused me heart attack when I read the script, the type of question being asked for the patient. That's why I'm not surprised why people getting 1 and 2 in their data gathering. Because for example, if the patient, let's give example. If the patient, for example, telling you, I have fever, okay? So she told you, I have a fever. So don't rush to your DD after elaborating the fever, ask anything else. So when you ask anything else, you will find that this fever is just caused by flu-like illness, okay? And when you ask her anything else, she will tell you nothing at all. So obviously it's just very acute fever for 2 days, and the patient is healthy, came to the clinic by herself, speaking to you lovely and nicely. Why you think about serious condition? Why you trying to exclude meningitis? Not okay, no problem. You can ask any rash is fine, because lots of medical conditions could be associated with fever. The fever itself can cause a rash. But do you like, why should you ask any neck stiffness, any seizures? So if she has meningitis for 2 days and she has fever, she will not be in GB clinic speaking to you like this and telling you, I have fever, which is with a runny nose, and it's not really very bad, and I took paracetamol and it get better. So when the patient telling you things, try to process what could it be, make your DD to the limit, make it serious too, but don't ask questions that is irrelevant. Even if it is red flag, you have to ask red flag that makes sense. Don't ask something that is absolutely would never be right. For example, the patient telling you, I have headache, and even the headache now, if you ask him, do you have headache now? He tell you, no, I took paracetamol, I feel better, but it's a chronic headache and it's been bothering me for a while. And so, and you still keep asking them about meningitis symptoms, for example. So just, and he doesn't have fever, and the student or the doctor is going to ask about meningitis symptoms. So please, when you take your data gathering, make it to the point, make it to the stations, make it to the patient. So don't get out of, so they will not going to give you. So I know like many people ask long list, and they get only 1 or 2. So please think about it. Think what I want to know in this station, what kind of question I need to know. And the major or the main point of collecting the data is to address the patient concern. So first we will know the patient concern, but just by asking, how can I help you? They will tell you the main concern in the first line. So now you need to take history just related to this main concern. And in the real life, the patient could have all the positive symptoms in the world, but his major problem he coming with right now is just related to new symptoms. Whatever chronic medical conditions they have is not our business. We need just to find out what is their acute problem and what is their main concern, and to address their concern and treat it. And otherwise, You will never manage your time and you will never ask relevant questions. Sorry, I'm admitting. All right. So in this case, in this gender selection station, so what is our data gathering would be? So the woman main concern, she telling, I need to want I want to have a baby. Can you help me with that? So first things you need to tell the woman the IBS part. So I would always say cover the IBS before addressing the medical reason, because even if the patient felt happy and they are understood, their concern understood by you, whenever it's coming next from you, it's going to be relevant for them and they're going to accept it. But yes, that's why I would always cover the IBS part before addressing any medical problem. So when she told you, I want to have a baby, so tell her, yes, this sound very interesting concern, and I'm here to support you with this. But before that, so I would do my best to help you. But can you tell me, is there any specific concern that make you want a boy, for example? So first we need to know why she wants a boy, and then we're going to elaborate a little bit further and asking about do you have any specific concern? So always ask about ideas, concern, expectations. Could be fit anywhere in the history. It depends on the station. So this station is mainly counseling station. It doesn't have it doesn't have medical history, it doesn't have history-based station. So when it's counseling station, so your data gathering, it will be mainly about ideas, concern, expectation, rather than just history-based. So so we need to find, we will have to find her concerns regarding having a boy. So the concern for this woman, like throughout the station, she had 3 concerns. So the major concern, obviously, she wants a boy, and she has 3 girls. But like she need to know about if there is any medical techniques, which is we discussed right now. And she needs to know if there is any natural ways, and we also have spoken about them. We told there is very little evidence to support that. And she needs also to know if she can abort the child, if she got a girl again, is she allowed to get abortion or not? Which is, as we said, it is absolutely illegal. Okay, so we will never know this concern unless you ask. So always keep asking in your Plab exams. Any other concern? Is there any specific concern that you have in mind regarding this gender selection? And okay, so we now know her concern. So we know her concerns very well, and you know from the medical background, just you read now, so you know that it's only legal if there is any genetic problems that could be transmitted to the girls population, because she doesn't want girls. So you can offer her to have a boy. So you know this information. So also we need to ask if there is any genetics problems in the families. And how we can know this, we can ask about the girls themselves. She has 3 girls. We can ask about their age, how are they now, which levels, like which level of education, because if they are in secondary school, for example, so obviously in normal school, they don't have mental problem. Lots of genetic problems can be, less of genetic problems can be excluded. Okay, I will answer the question in the end, so anyone can write in the chat, but I will read in the end. And what else? So also you can ask about previous pregnancies in general. Was there any complication in pregnancy or in labors? And when you finish elaborating the girls, So you can ask her, what about you? So thank you so much for sharing me information regarding your girls. Now, what about you? Are you generally healthy and fit? Do you have any medical conditions, any medication, any allergy? Why we ask about her past medical history? Because if she might have something that would affect any upcoming pregnancy. Yes, in the past she has 3 girls, but we don't know her situation now. Maybe she has some medical issue that even prevent her from getting pregnant. So we need to find out about this by asking past medical history. And in any station, we have to address psychosocial aspects. So we will ask, like the fact that she has 3 girls and she doesn't have any boy, how this affected your life, and also your mood, how this affected your mood, and relationship with the husband. Maybe they have very tough time because of that. So we have to address this part as well. And yeah, so this is mainly about the stations, I think. And what else I have missed? You can also ask personal history if you have time for that, just to fill the gap, smoking, alcohol, because also it's going to affect the pregnancy if you want to get pregnant in private. Yeah. Okay, so if you have any questions, please write in the chat. I will be reading and answering. Okay. No, so the mother is not allowed to abort unless there is severe genetic problem, which is going to affect the upcoming baby. Even if it is like mild one or there's treatment options available for this genetic problem, they were not going to allow her to abort it. So that severe genetic problem that could handicap the born baby, in this is the only case we're going to allow her to get abort the baby, or even if she get pregnant, her life is going to be threatened by this pregnancy. So she had heart problem, severe heart problem, she may have heart attack. So this kind of thing we can consider, but otherwise abortion is totally illegal. It is illegal that procedure where gender selection is possible, or can we offer her for that? I think you are one of the people who joined late, so we read in the papers. I will share in the group, and also you will listen to the recording, so don't worry about this. But as I mentioned, there is only one procedure which is legal for gender selections and available in the NHS, but it has to be in very, very certain situation, which is there is severe genetic problems that could affect the upcoming undesired baby sex. For example, if she want a boy and she had her husband has X-dominant conditions that could be transmitted, X-linked dominant conditions that could be transmitted, for sure is going to be transmitted for the next upcoming girl as well. So in this case, we're going to offer her this procedure. However, so you need to ask her, how are your girl now? So if they are all fit and well, healthy, so it's unlikely there is any genetic problems that will mandate these procedures. I will share the record, don't worry about it. Any questions?